I'd like to introduce our Senior Director of Programs and Innovation at Cool Culture, Dr. Ayoka Wiles.
Good afternoon, everyone. Thank you, Tammy. Thank you to the Cool Culture team. It's such a delight to be able to have this conversation in light of everything that's going on in the world. I want to welcome all of our families, Cool Culture families, and those from around globally who are joining us from different parts of the United States and different parts of New York City. I want to wish you all good, well, and healing and safe and health and wellness. But today we're going to just jump right in, and we have such amazing panel of experts who have joined us this afternoon for a conversation of moving from coping to healing. We have Takiema Bunche Smith, who has served children and families and educators in New York City for over 2 decades in a variety of roles. First as a classroom teacher, and then as a curriculum designer, and most recently as a parent advocate. She's currently the president of Anahsa and a nonprofit executive of early childhood programs. We also have Dr. Michele Zaccario, who's an associate professor of psychology at Pace University in New York City, where she teaches both the doctoral and undergraduate programs and currently serves as the co-director of undergraduate psychology, the New York City campus. She's also a New York State licensed psychologist who is a consultant practitioner with the pediatric department of New York University's Langone Medical Center. We also have Dr. Christopher Godfrey, who's also a board member of Cool Culture, and it's always a pleasure to have him working with us and on this call, who's a clinical health psychologist who studies community health and health disparities among New York City's diverse community settings. He's also a professor of psychology at Pace University, where he's recently co-directed the Office of Multicultural Affairs and currently directs the Center for Human Health and Education Research. We also have Dr. Carolee Ngozi Wosu, who's a general pediatrician who has been blessed to serve diverse patient base of communities from around the world. She's also worked for several years as a primary care pediatrician at Riverside Pediatrics, and as well as a hospitalist coordinator at Christ Hospital in Jersey City. She ran the pediatric ER, inpatient pediatric floor, and she has specialized in assisting mothers with difficult births and infant resuscitation and breastfeeding education. And we also have McClean, who is the president of the Community Education Council for District 16 in Brooklyn, which serves Bedford-Stuyvesant, and he is also the co-chair of the Education Council Consortium, which includes parents, community members who have been elected or appointed to serve on district and citywide community education councils across New York City. So I want to jump right in because we are in unprecedented times in New York City and around the world. But while all these things are happening, lots of conversations are happening about people's health, their well-being, their mental health. One of the things that I think families are asking about, how do we share information, especially for preschoolers, especially for families who are trying to understand, how do we communicate with our children about this pandemic? What's the most appropriate? What's the way that can help them really cognitively understand what's happening? How do families share and have conversations with young children about staying at home, remote learning, and the uncertainty really of turning to normal and whatever normal life becomes?
Hi, that is a really good question from the community, and one that, even professionals grapple with. But the short answer is we try to be as honest as possible to even very young children in a manner that is age appropriate and comforting. So we don't want to share every fear that we have about COVID, but we also don't want to hide some of the realities for children who are very young. So we have to find an age appropriate way to talk to them. The important thing is you can talk to your preschooler. You can even entertain questions about, why are we outside? Why might I be separated from dad? Why might mommy not be coming home right now? Why am I not in school? These are appropriate questions that they will have, and answering in a way that reassures them of their safety right now is important, but also recognizing that it is an uncertain time. They may be confused. It might feel different. That is all okay to share with your child in a way that you're comfortable with and that the child can handle.
Thank you, Dr. Zaccario. And I want to join Takiema in this conversation. As parents and adult caregivers are dealing with multiple challenges, maybe balancing working from home, maybe balancing going to an essential work environment and coming home. What do you see along with these conversations of talking to preschoolers, talking to young children, even middle school and high school? Still, you know, we have lots of children who are graduating and are lamenting and are disappointed about not being able to have an in-person graduation. What do you see are effective approaches?
I think, first of all, there's no one answer and there's no one right answer. And I think that's kind of the point, that people need to, whether we're in a pandemic or not, we need to center children's voices and find out what their perspectives are. So even for the youngest of children throughout high school, we can't make assumptions about what children know and also what they're worried about. It's often very different than what we are worried about as adults. And when we are under the levels of stress that we are collectively experiencing right now, it can be easy for us to transfer those anxieties onto our children. So I think first of all is to kind of just take a step back and actually have a conversation and also be an observer to your child, right? Because verbal communication isn't the only way that people communicate, especially children as they're much younger. So if we're talking about preschoolers, you want to take a moment to just observe how they're playing. If they're playing with dolls, you know, you don't even have to be in the room, but just listen. You know, what kinds of role-playing words are they saying? What kind of behavior are they having? Are they wetting the bed? Are they coming to try to sleep with you? Has something shifted in their behavior? That can give you a little bit of clue as to what's going on for the younger children. And for all children, you know, I think it can be helpful for us as caregivers to remember that as huge and life-altering as this moment is for every single person, and in many ways it's negative, it's not the first time that families have experienced stress. You know, it's not the first time and it won't be the last. And so there is a level of resilience that can happen through this experience that we have to remind ourselves, like, this is the totality of our lives. And this is a moment for us to use this as a time to say to children, we actually don't have all the answers, but here's what we do know.
Thank you, Takiema. That was really helpful. And Dr. Godfrey, can you please share some other insights as a psychologist about, you know, alleviating fears, dealing with the current situation and how adult caregivers can support their children?
I think one of the other things for us to be aware of is that children are spending a lot of time with us as adults in ways that they've probably never really spent with us before. So one good way of just helping kids process is to also acknowledge that we're all spending more time together as families. And frankly, kids are probably part of our lives now in ways that we as caregivers probably have to adapt to become comfortable with, right? So I know that one of the things that we've definitely hear more of and see more of is that blending of the multiple environments. We have the workspace that's become part of that home space, that's become part of the many different spaces that we all occupy. So often being able to be aware that children are seeing caregivers maybe in different lights, in ways that we didn't anticipate being seen as caregivers. They see us working and doing everything that we do and trying to navigate uncertainty. So those are often conversational opportunities. For older kids, we're also getting to see parts of their lives that we may not have seen before. As caregivers, I think one of the things that is most difficult to let go of is that we have this idea of that we know what our kids are doing all the time, and we do not. And suddenly we have them in places where we get to see their lives that may be their emerging lives often, that are existing in ways that we may not have seen before.
I'm a mom as well, and I have a preschool age child, and he's always asking me, are we going to school today? Are we going to school today? I've come up with some creative answers. I don't know that they've been sufficient enough for his curious 4-year-old mind. What is a line or a series of things that parents can say, caregivers can say, like in terms of why they're not in school?
this is very typical of preschool behavior in all circumstances where like things aren't asked and answered once, but you're getting same questions all the time. So if you think back pre-COVID, how many times they'd ask you like the classic, are we there yet kind of question, where, you know, you're answering, you think you have a sufficient answer, and that question rolls back at you in a little while. So it's a very natural process that they're engaging with, you know, checking and re-asking and seeing if the situation has changed, or testing the limits of what your answer might be, if you're always consistent or not. So I think that it, the checking all the time is, you know, it could be, it could be about this, but it could just be a normal reaction. And if he is comfortable with the answers that you're giving, I don't think, like Takiema had said, there isn't one answer that all children are going to feel better about, but whatever has worked for him on that particular day may be good enough, knowing that tomorrow you may have to answer the same question. As long as he feels comforted in the answer in that moment, and he can go on with a, you know, with his activities there, that you're doing a good job.
Stay within the confines of what you know that you can answer. We don't want to invent answers that if we don't have the information for inventing the answer. It's perfectly fine to say, I don't know. Right. Sometimes that is the most important thing for us to say, as it does help children to really understand and grasp, and that helps them understand that we are good with uncertainty. Right? They're going to follow our lead with uncertainty.
I think we have to really remind ourselves that learning happens everywhere, not just in school. And if we as adults started to really grapple with that and embrace it, then it's a way that we can set the tone for our children. So a simple line, like, so as you start going through this, right, but you keep the same line, learning happens everywhere, and school learning is paused for now, right? So if you can just take that phrase, but then you've now got to put some meaning behind that, right? So you've got to then say, when I ask you to help me make this dinner, or set the table, or separate the laundry, and we're counting and we're looking at colors and we're making up imaginary stories, look, we're learning right now. Remember, learning happens everywhere. So if we can start to think about that with the youngest of children, I think that it will allay some of those fears, and it gives us a little bit of time, because quite frankly, the chancellor said there's a 50% chance that schools are opening in September.
I want to start off with Takiema left. She hit it right on the nail. People are going to have a different experience coming out of this. People that were already thinking about becoming homeschoolers may think, oh, this is not as bad as I thought it was. This, as the other doctors were talking, I was actually just sitting here thinking about, this is a great opportunity. This is something that we've said to really reimagine how education look in the city of New York. And it will no longer be the same. It will no longer be the normal going into a school building. Like, there's going to be different options. I'm sure that there are people lined up ready to start their online platform for online learning and expand the ones that are already there. It's really, a time that we look at this opportunity to really push the system to do right by our students. And, listen, I don't want to be a teacher. I'm ready to send them back to school, but I understand that it starts with us, and it starts, we now have a different perspective of how we look at things. I think it's going to be a new way that the system moves once we get back into it, whenever it does happen.
Thank you for that information. How best can families sort of protect themselves now, and from the sort of health standpoint?
One thing that parents can do is please limit the sugar. Sugar is a big deal. It makes it very difficult to fight viruses.
Okay.
Especially sugar that you're drinking, because you're not even feeling the fullness. There's a tendency of just oversaturating yourself with sugar if you're drinking it. Also, like the snacks, like we need to explore like limiting our doses of the snacks. So we shouldn't let people just reach right into the bag. We should just see what is the measurement and see if you can live with 1 serving, maybe 2 servings, because you got to see that sugar. It's making a difference. Your natural killer cells get stunned for a few hours with just a teaspoon of sugar. Also, there's a lot of supplements or vitamins or just general healthy food, which is also a big issue because prior to this, poor eating habits is a huge deal in multiple communities. When we are feeding our kids correctly, we're creating a reserve for moments just like this, because there's such a high amount of people who catch the virus and they don't get symptoms, or they get very mild symptoms. There's not really many studies right now. So I can only imagine that the difference between the people who get the very bad symptoms and the very light symptoms is their immune system. So
families, if they are worried if whether they themselves or their children are experiencing any symptoms, to call their pediatrician for a telemedicine appointment?
yes, would be good, but then there's also like a cost issue and what's going on in the house. So sometimes I see, like, if there's children, a family where there's children and everybody's at home and they're doing their very best, they have the opportunity not to have to go out to work, just the occasional grocery, if they can do that. And then somebody loses their taste and smell. I actually just had that the other day. That's it. That's their only symptom. Everybody else is healthy, you know? I tell them, be aware, this sounds like COVID-19. However, because I'm in New Jersey and it's almost impossible for me to get my patient a test without them paying a lot of money. It depends on what the circumstances are. Is there an elderly person? Is there a person who's medically fragile? Is there a way for this person who's having these symptoms to isolate a bit? Do you have access to masks and other, at least gloves, cleaning materials and things like that, just to be aware of, because sometimes the patient is right on top, the mother is right on top of the child, explaining, and the child is a teenager, it's like, you gotta wear a mask now, you gotta assume you've both been exposed. Like sometimes I see parents who are essential workers, like the father's a cop, and and he's saying he wears a mask sometimes he doesn't. And I understand that when you have a job where your eyes are doing a lot of work, your face is doing a lot of work, and then all of a sudden you got this, it's hard to do your job when you're trying, you have to connect to somebody and talk them into things and out of things. It's hard to do that with just your eyes. So, but this is a strange time. We're gonna have to do what we have to do. But I think that if you're concerned that this is, it's feeling like the symptoms are more serious, like the child has a fever, or if the child has any shortness of breath or any cough, then I would contact the doctor. Because unless, of course, there's somebody who's going in and out, like they're a transit worker or a warehouse, or they're driving a truck, I think it's very important to know all their exposures.
I just wanted to touch a little bit on this idea and then move into how we move into across the spectrum from dealing with in the beginning of this call, we talked about dealing with our fears, helping our families and our children, adult care, and also Takiema mentioned the role of adults in this process of how we move to healing, right? So there's, how do we identify when our children are our teenagers or any members of our families are dealing with the fears and they're internalizing them, and there may be some elements of depression or anxiety. How do we identify that, and what are the best solutions?
So first of all, it's important for us to acknowledge that having a degree of anxiety and fear or concern is absolutely normal for people across the age spectrum. Kids, teenagers, adults are all going to have those experiences, and that's normal in this time. It's when those things when folks start to ruminate on them, that they really kind of become the only thing that they can think about, then we want to be a little bit more concerned. And this takes us back to something that we were talking about earlier. It's so important to be good observers of the people in our households. Michele, or maybe.
Oh yeah, you said exactly how I was going to start off, that that a degree of fear and stress and some sadness over where we are right now is not atypical and not something that we should necessarily worry about. And it's okay for people to have these feelings. So not negating these feelings is also an important thing. So if your child says, I'm scared, we don't want to say, no, you're not, it's fine. Or if, you know, your spouse, your significant other shares their feelings, to sort of just let them have those feelings. It's important. Your teenager may or may not share feelings, because that may not be at all COVID related and just normal teenage behavior, but you know who your teen is, you know what they're like when they're in different moods. So paying attention to that is important. As Takiema said before, just observing what is normal and typical of the people you know in your life is important, because they may be a little different under these circumstances, but they're still, you know, fundamentally who they are. So if they're, you know, if they're the people that they always have been, but just with a little more questions, a little more anxiety, a little more sadness about what they're lamenting and what they're losing right now, that's typical. But if they change, they stop eating, they're overeating, they're not getting out of bed, they're, as Chris said, they're ruminating, they're only talking about this, they shut off in their room all the time and not, you know, on their phones or on their devices with friends, but just laying in the bed and, you know, staring at the ceiling. Like these are behaviors that we would be worried about. And then you would want them to talk to you and for you to access perhaps some, you know, expert intervention. But there's a lot that we're going to allow for people to experience right now as we're in this atypical time.
I think to just tie into what everyone else has said around paying attention to your child, recognizing what normal behavior, quote unquote, for your child has been, and also for yourself, because remember, we are also experiencing these things. And so we have to check in with ourselves almost before, or at least simultaneously as we're checking with children. But I just want to make a suggestion for people that I think is very simple, free, and actionable, like as soon as you get off this call. And so we understand that our bodies and our brains are greatly impacted by stress and trauma and grief, which we are all navigating to some degree. And mindfulness and mindfulness meditation and the breath are things that actually mitigate stress in the body. It actually takes us out of fight or flight, which many of us are living in for many days. And it's something that you can do with the very, very youngest of children. I got trained to do mindfulness with preschoolers. And so there's games you can do, there's activities, you know, pretend you're blowing up a balloon and just put your hands on your belly. To a little bit older children, you could actually go into a very simplified version of the brain science around it. And the way that we spoke about it with young children is that your breath is your superpower, because you can actually practice feeling your heart rate slow down. And when your heart rate slows down, all of those stress hormones that are making you feel crazy start to calm down. But the key about this is something I learned through not doing it again. I'm giving you lots of examples of not following my own advice, although the global pandemic has got me following it more now, is actually to make a practice of doing it every day.
I wanted to just ask a closing question. If NeQuan, if you could also share any if families are still having problems with getting access to technology, if they're having problems with access to food, access to any resources for remote learning, if they're having problems with their school around grading, if that message hasn't come across clear, anything of those kinds of nature, if you could share with our families.
If you have any concerns around your grading policies there, you always try to reach out to your school. There's a school level, which is just principal, but then if you're not getting any support from the principal, then it's the superintendent of the district. And then we have something called executive superintendent, which is over. That's a lot. I can send it to you if you want to send it out, but it can be a lot. Around devices, there are several numbers that you can call. So if you have not gotten a device, every student should have a device. If you don't have one, then you need to reach out, and I can send the link for that. They ordered 300,000 devices. I think as of the other day, it was something like 267,000. So there's a couple of thousand left. So I would advise people that if you
Those
don't have
devices are iPads, laptops.
iPads. Yeah,
Okay.
so they're iPads, they're Apple iPads. I actually just got 3 for my kids because I'm like, this is gonna go on for a long time. And let me get some. So we ordered them on Friday and we got them on Tuesday. So they come very quickly. It's an Apple iPad and it comes with the case. And to the food, so each district school should be having a food that is now not only for students, like the free lunch program, but it's also for adults. Students can go, I believe it's from 7:30 to 11, and then after 11:30, any adult can go and get 3 meals. So they said breakfast, lunch, and dinner. It's actually not dinner, it's breakfast and 2 lunches. But you can actually go, and as a parent, you can go and pick it up for your whole household.
Yeah, and you don't have the child.
You don't have to have the child, you don't have to have ID. You just go, the food is there. There's several locations. I think there's, in the whole city, there's 470 locations within the city. But I could send you the link that will show you in your district what schools have it. I also have a list of food pantries in every borough. There will be 5 town halls within the next couple of weeks in each borough with the executive superintendents to discuss remote learning. And then there'll be some town halls, themed town halls that will be given by the deputy chancellors around grading policy, admission policy. And soon when I get that information, I'll definitely share it.
Thank you. So we have, we've gone over a little bit, and we have so much. I mean, we could probably continue this conversation, and maybe we do. I'll chat with our panelists about maybe there's a part 2 to this conversation, because I think there's a lot more that we can talk about. I want to ask all of our panelists if you can give us, like a sentence or 2 to encourage families, adult caregivers, adults who are under a lot of stress. What is the one thing that you would advise that they start off Monday, it's the beginning of May. What is the one thing that you would advise that they do to keep healthy mentally, emotionally, spiritually?
I would recommend that parents try to center themselves, because a lot of what the children are experiencing is just like the echoes of the parents, the energy that the parent is bringing into the room, and also focus on the things that we can do or that we can actually control.
Yes, thank you.
I was going to say something very similar, just that there's an acknowledgement that you're doing what's good enough, that you wake up on Monday and not have the laundry lists of all the ways that you're not going to be okay today and all the ways that you're going to come up short because you're not as good of a teacher as the teachers that your student, that your child really has. You're not the good enough mother or father that you hoped you'd be during this time. Instead of focusing on what you do bring to the table, starting off positive and beginning with some relaxation or some mindfulness for oneself, so you can get to that place where you can feel a little more like you're good enough.
Thank you.
Sure.
I would say that that now's a chance that we can make a decision on whether or not we're going to try to replicate oppressive systems that we've been struggling against before Corona inside our own homes, or if we're going to make some different choices. And if we choose to put humanity first, if we put our own humanity, the humanity of our children, the humanity of our community first, then we'll be able to do some of the things that the previous panelists just said. If we say, this is not working for me right now, because I'm centering my full humanity in all of my identities, then we've taken some power back, and we've also released ourselves from oppressive expectations. The second thing, because I know, listen to directions, Ayoka, is I think everyone should get this book called Ring the Alarm by Nicolai Pizarro. She's on the call, and the reason why, there are many reasons why, but she believes truly that parents are the children's first teacher, which many of us do in the field. But in this short, simple book, she breaks down neuroscience of learning. She talks about how low-income Black and Latino caregivers in particular can create learning environments for their children in their homes and in their lives. And it's very clear, cheap, free, actionable, and culturally responsive.
Dr. Godfrey? NeQuan?
On Monday morning or throughout our days, remind ourselves, be kind to ourselves. Then all those times when we're gonna not get it right in the way that we think we're supposed to get it right, it's really okay. There is no getting it right. The best thing we can do in those moments when we think that we're just feeling stressed is to take that moment, breathe, take a moment, be kind to ourselves. If we do that, then we'll also reflect that to our children. They'll see also that it's okay. It's okay to make a mistake. It's okay that it's not perfectly right. It's okay that we can be uncertain.
So I want to thank you all for joining us, and all of those who have joined us. I want to just keep in mind all the things that the panelists have communicated today. It was so amazing to remember to stay centered, to meditate, to be mindful, to stay away from the news and all of those negative influences with your children. If you do need to see the news, check in by yourself on your phone while your children are sleeping and focus on things that are centering your families and centering yourself and humanity first. I love that. And to be kind to ourselves and to be okay that whatever you're doing is good enough for right now. So I want to thank you all. Yes, a virtual hand clap. And we will be sure we have your emails there. We'll be sure to send you all the resources that our wonderful panelists. I want to thank you again for giving us just amazing information, just so powerful.